All right, 10-minute snack. Everyone knows the rules. Let's eat. Okay, so I have the pleasure of having Dr. K, Dr. Kiltz with us today here for Meat Health Snacks. Dr. K, thank you for joining us today.
Well, Kevin, Dr. Stock, thank you very much. I really appreciate the invitation and sharing how important meat health really is.
Well, I agree with you there. So I have a couple interesting questions here. This is snack, so we try and keep it to 10 minutes. I'll do my best because I have 3 hours worth of questions. But the first thing that came to mind was as dentists, we have to do 50 hours of CE every 2 years. And my license came up for renewal last month. So I was doing a bunch of CE. One of the courses I took was on oral health and nutrition. And I'm not going to go down that rabbit hole. It was the worst CE program I've ever had. The question I have for you is, going through your resume, you are the founder and director of CNY Fertility. You are a diplomat of the American Board of Obstetrics, Gynecology, fellowship trained, board certified in reproductive endocrinology and infertility. My question is, do they teach what you are teaching about nutrition and fertility? Or is this something you had to go figure out on your own?
Well, I'm sure just like you, although Weston Price was a dentist that shared a lot of this stuff, but in the OBGYN and the reproductive endocrinology and fertility world, no one is. And in fact, recent OBGYN journal came out with an expert opinion and basically said the Mediterranean diet was really important for pregnant women and breastfeeding women. And they also included wine as okay for them to drink. And then they went on to say that Atkins, paleo, and keto diets were a no-no. They didn't even get to carnivore yet. But no, I've learned this all on my own by people like yourself and so many people through the years that have just inspired me to do and share even more of this.
So many questions. One is actually, I was watching your TEDx talk again today. It is fantastic, by the way. Are you a trained speaker? Because I was like, wow, this guy, you must have some training.
It's I always say I'm a kid from LA, kicked out of school, couldn't read. I was dyslexic, and my father in jail, and that was a good thing for him for the year that he was there. But no, I didn't train to it. But the one thing I've learned by watching people like yourself and so many others, we can train to do anything in life. Just because you weren't trained or didn't know how to do it, the act of doing it is training in and of itself. So I've learned so much. I'm 66, almost 67. I've been practicing medicine for a couple of years, but I feel like I'm just getting started every single day.
Well, you look absolutely fantastic. 67?
Almost. March.
See, a testament, a personal walking testament. I think that's actually very important. Where like people that practice what you preach.
Absolutely. I feel younger and younger and younger. And you're probably 30s?
Yes, I will. I'm 35.
You're 35. And you're my daughter's age. She's 34. I got to tell you, if you doing what you're doing at your age, it's a game changer for the future. That I will tell you. I wish I knew it at your age, but it's good that I learned it at 55. I started pretty carnivore. Before that, it was keto, paleo, and Atkins and running and running and running. But the real game changer is that you could change any day of the week.
Mm-hmm. It's interesting. I feel young. I go to this gym with a bunch of college students, so I'm 10 plus 10, 15 years older than everyone. I'm like the old man. I feel young though. But I also feel old in a way that I've been in like this nutrition space for 20 years, meaning like doing diets, trying this. So it's an interesting thing. Now, Dr. K, I want to go to your specialty, fertility, carnivore diet. My question around fertility really is, you obviously believe nutrition plays a huge role in fertility rates. And to me, it seems like, I guess from an outsider perspective, fertility rates, or just the difficulty in getting pregnancy, I should say, seems to be a more common issue, at least something that I hear of. I don't know if those rates are actually increasing like at a population level, like incidence, but maybe you could tell us, is that the case? And is it like what's driving it? Is it PCOS? Is it the male low testosterone? Is it a combination of the two, or many multifactorial?
Well, I am of the opinion today that nutrition is responsible for our health and our disease. And more are waiting to have a baby. So they're waiting till their 30s
Right.
and their 40s in some cases. So that's one reason, postponing childbearing. The exposure to plant toxins, plant chemicals, plant estrogen, progesterone, and testosterone, and then the sugars, which cause glycation, will damage the reproductive organs, the hormone producing organs, the hypothalamus, the pituitary, the testicles. And so all of our hormone producing glands, the pituitary, the adrenals, the ovaries, the thyroid, are all being damaged. And so it is on the rise, those that are suffering from infertility, both on the male and the female side, bad sperm concentrations, motility, morphology, DNA damage, lower testosterone levels, which I think are all secondary to a plant-based low animal fat diet as the leading cause personally. And then things like PCOS, metabolic syndrome, diabetes, prediabetes, endometriosis. I spent several hours today on a young lady with severe endometriosis, and she's been working on Carnivore, but it's been very difficult and fallen off of it because it's just such a mind-bending idea. But it's growing. I've never been busier than I am today, and seeing people from around the globe. It doesn't matter your culture, your social status. It's happening to everyone.
Mm-hmm. So in your protocol, if you see a patient, let's look at a couple extreme examples. One is, let's say someone's second trimester, third trimester, like, okay, I want to get on this carnivore diet. Would you be like, let's pause and not make a drastic change at that time period? Or how, because this is one of those questions that I get a lot. I'm like, this is not my expertise, but it comes to the top of my mind. If your third trimester, maybe not make a radical change at that time. But I would love to hear your thoughts on that.
Well, what you know about healthcare and health coaching, it's now in the hands of everyone. It's no longer just in the hands of MDs and DOs and dentists. It's really taken over to other areas. But it's never too late to be the healthiest you can be. And the incidence of premature deliveries, large for gestational age babies, which have very difficult chances of a vaginal birth, and they're requiring C-sections, hypertension, preeclampsia, seizures, depression, pre and post delivery are all on the rise. So, and we know that the optimal human diet is carnivore, is a meat-based diet, and eliminate plants of any significance or frequency. So I think the time is now, and being pregnant is the most important time. You have a beautiful growing human being that is being exposed to plant toxins, excessive sugar, and fermentation of your plants in your bowels that make alcohol, that I think adversely affect your baby, likely increasing reproductive disorders for the future, and autism, and you name the disease. I believe it starts in utero, and so when you're pregnant at any stage, it's the right time.
Very interesting. So obviously this continues on post childbirth, continue breastfeeding, like, because that's the next kind of question I get a lot. Oh, I'm breastfeeding, is this okay? I'm like, and I have the exact same opinion of you, because I see pediatric patients a lot. I'm like, it's even more important for these kids to have good nutrition than you, your parent. So I'm like, yes, like it is crucially important.
It is. I say moms, infertile or fertile women and men need to be carnivore. And when they're pregnant, they need to stay that way. And once they've delivered the baby, they're going to be better able to breastfeed because they won't have the damage to the breast tissue or the other hormonal organs that are critical for that. And when your baby is done breastfeeding, so meat from a bone rather than milk from a breast, that's the transition. And it is important for us to teach everyone. And the more that are experiencing this, then sharing their experience, it's a game changer. And I'll quickly just show you a little bit what I give to everyone. I call it the baby's way: bacon, eggs, butter, beef, intermittently feasting. So it's still better to eat less frequently. Eating all day is not good. Now, and I do make an ice cream with very little to no sugar. That's the important part, cream. And then salt, I think, is really, really important. We're not consuming enough salt, in my opinion.
I love that, and you keep it very simple. I basically that's exactly pretty much how I eat: beef, uh, eggs, and some dairy here and there on occasion. So
I think the dairy, some people don't tolerate it as well. I think, but if you focus on meat and eggs, you're going to be healthier than ever before.
yep, I totally agree. You know what's so interesting? It sounds like the kind of like the BLW, the baby led weaning process from breast milk onto meat on the bone. That is also so important in oral health of that child, to start chewing for full development of the jaws, to prevent malocclusion. And it's just so interesting that the perfect parallels, which it isn't surprising, but tends to be good for like oral health, probably good for, fertility and etc.
I've been studying the glycobiome. The glycobiome is the sugar layer that protects our body, and it is damaged by eating sugar.
Mm.
And so, and I didn't know this, but the glycobiome is the protective layer on the teeth and the enamel. And as a child, I had terrible teeth, and I bled all the time, and I had to have many cavities. And I got to tell you, Carnivore has just changed all of it. No more bleeding. I haven't had a cavity in like at least 20 plus years, which has been remarkable.
And it's interesting because tooth decay is the most common disease in the world.
Yeah.
And you would think, I was recently just talking about this past week, you would think there would just be a mountain of research done on tooth decay. And since we know carbohydrates role in it, you would think like ketogenic diets and tooth decay, there should be tons of research. I am digging through the research trying to find, I'm like, the most common disease in the world. We have a pretty good idea of what the solution would be. And there's a dearth of research in the area. It's just quite frustrating. But that, what made me think of that is I was trying to find someone who's been on the carnivore diet and developed a cavity. And so far I cannot find one person who has like an X-ray pre-carnivore that shows a lesion, and then a lesion that developed on carnivore. I am still waiting for this person. I'm not sure it's possible.
I agree with you. I think this is the game changer. And that the challenge is so many people are losing their teeth, and then they're going to have difficulty with their meat consumption in the future, unless they're doing ground meat and butter and things like that. But we want to inspire young and old at every stage of life to look at carnivore as the game changer for truly the master class.
Like truly, it's the foundation of the human diet. It's the baseline diet.
Yeah, and it's interesting because we're looking for the evolutionary evidence that we ate like this, which is kind of fun and interesting, but it's irrelevant. You want to be like the healthiest person you could ever be, that this is it. And so whether we ate plants or not, we could argue that, until the end of the earth. But ultimately, we know. I see how you look and feel, because you can see the energy in people, the glow, the sparkle, and our clarity in our minds is just so masterful, in my opinion.
I 100% agree. It's the reason that I actually started down this road many years ago was searching for the mental clarity, performance. Like I was feeling sluggish and like, how do I get through the day? And sure enough, this is where I found it, where here we are, we're in the evening, been going all day. You just told me you had surgeries all day long. And here you are, clearly nighttime, full of energy, continuing on, where most people, I think, would probably just be plopped out down in front of the TV, checked out.
Well, it's interesting. I do take 1 to 3 naps a day, 10 minutes. It's meditation, prayer. And I just sort of kind of, it's just below, just barely in the sleep range, right? I think we don't nap enough and we don't sleep enough. Now I go to sleep at 9 p.m., get up at 3 a.m. I do my motion work, my workout, light stuff, light weights, nothing excessive. But I read books, listen to podcasts or other books to get inspired for the day. And then I'm live at 5 every morning on my YouTube, Facebook, and Instagram.
Wow. Okay, we're going to have to definitely do another full meal, because I would love to hear more about this daily routine, because I also would have been quite early, like around 9 o'clock. I will wake up usually between 4 and 6. It is variable. Just based on work needs, but I have not been napping. But maybe it's something I could incorporate. I feel like I don't have a need currently. So,
well, I don't know that I would say I did it when I was younger, but I didn't eat the same way. But I use it again. I'm going, and it's like, hey, I'm a little tired. I used to drink coffee. I don't drink coffee anymore. I don't drink any stimulants, and so I think it's the nature. If you look at many lions, wild cats, right? Cats and dogs, like they're not going. They rest. So I think it's one of those things that it's a good habit. I don't nap for like hours.
sure.
I in small amounts to regenerate. Sometimes in my office, I have a couch. I'll tell the team, hey, I'm going to take 10 minutes. If you need me, come get me. But otherwise, I'll see you in 10 minutes.
I really am intrigued by this. I agree, because I've done I've like studying indigenous tribes, and the number one activity they do is nothing. They're not out hunting all day long. They get their food, they're done, and leisure is the number one activity. And I think the always on is probably a modern phenomenon that probably has some untoward consequences.
And I know I enjoy, this is enjoyment. I can probably do this stuff 24/7, 365. It's so enjoyable, the inspired and learning new things every single day. But I think we need to slow down and do less some days. And I'm a workaholic, but I don't work a day in my life because I love it. I'm just excited about it. But sometimes it's like my phone, I just got to put it away, and it's like, okay, enough.
Dr. Kiltz, this has been fantastic. I think I accidentally went a little bit over, but I think the audience will forgive me. We're going to have to do a full meal. Now, I know you have so many great resources. I've loved following you online on the social media platforms. We've talked about your studio before this. Like, the quality is fantastic. And of course, the information is top notch. Also, you got Kiltz, Mighty Tribe. You have all kinds of resources. So where can everyone find you?
drkiltz.com. It's a great place. And we're there to sort of help inspire others. And we want to know what other people's opinions and experiences are so we can all learn together.
Love it. All right. Thank you so much, Dr. K. And we're going to have to get him on for a full meal. But leave a comment. Just make sure to get those votes up so that we know to get Dr. K, and I can convince him to come back on and talk with me.
We appreciate it. Thanks, Dr. Stock. Really appreciate what you're doing.
Snack time's over. Did you enjoy the snack? If so, drop me a comment. Let me know if we should dive deeper and do a full meal on this topic. Also, P.S. if you liked the snacks, you're going to love our bites. A daily email bite, a golden nugget, better than a pasture-raised egg yolk. All right, maybe not that good, but it is a daily bite to optimize your health and nutrition with a meat-based diet. Access right now is totally free. Link below. See you in the bites.